Wonderful. Hi, everyone. Come on. Hi, everyone. Thank you so much for joining us today. I am personally so excited about our next panel, Building Villages, the Importance of Community Support. As y'all might know, we launched She's Good for Real. It's a health and wellness platform that's dedicated to Black women and women of color. Today we're going to highlight some successful community and media initiatives, like our newest partnership with Huggies, and we're going to discuss disparities in maternal health and infant health and the importance of media support and amplifying the conversation. Ultimately, our end goal is to help Black parents, period, full stop. My name is Ashley Banks. I'm the EVP of Commercial over at Group Black. I'm also a co-creator of She's Good for Real. With me, I have Dr. Dina Strong, who's a board-certified dermatologist at AGLO and the founder of findablackdoctor.com. And we also have Valerie Johnson from Kimberly-Clark, who just recently won an award for your work in maternal health. So congratulations. Thank you. And we can't wait to have this conversation because it is incredibly important, and everyone here today can make a difference, can help save lives. So let's dive in. I'd like to start off with the exciting It Takes a Village campaign. Can you each talk to me about why you felt it was important to be a part of the campaign? Who wants to go first?
Yeah, well, thank you so much for having me. I'm really excited to talk about this topic. And it takes a village. How many people out there have heard that phrase before? Yes. Do you know where it came from? Hillary Clinton, 1996. So in the 1900s, that phrase was born. And it really talks about needing the community to raise a child. And this campaign does that. It starts to talk about bringing awareness around a topic that's near and dear to my heart, and that is morbidity and mortality amongst African American women. And if you have not heard those statistics, there is a crisis. 1 in 3 women experience possibly death as a result of childbirth, and those are horrendous conditions. And so It Takes a Village is really part of how do you help this crisis? What do you do to make a difference? And that is building that sense of community. And that's what this program is all about. How do you build that community so everyone takes responsibility? If you know someone who's having a child, you help that family become very familiar with their resources. So just a quick snapshot on It Takes a Village and what's happening with the program. There's 3 parts to a video series. And the first part is about a family who finds out they're pregnant, the most exciting time in the world. And her best friend comes over and they introduce the baby through the sonogram through one of her daughters, and they talk about the excitement. And then in part 2, that's when they start to talk about, well, now it gets real. What am I gonna do? I have to find products, I'm afraid. How do I care for this baby? And so Dr. Dina comes in and gives some good advice on that. And that's where this partnership started with the brand called Skin Essentials that's designed specifically to help protect skin against the top 2 causes of rash. And as a dermatologist, I'm sure Dr. Dina is very well aware that 30% of the first visit besides your newborn check to a physician is because of diaper rash, severe diaper rash. And that's very scary for parents, very painful for children. And so part 3 of the series talks about what do they do next and how do they proceed? And Dr. Dina gives some very good advice in that area. And that's where that village begins to start to build. Yep.
So I would say, part of my interest in this is that I'm all about people accessing their resources. We hear a lot about lack of access to resources, but a lot of times the resources are there and we're not aware of them. We don't know all the tools we have. That's one of the reasons I founded Find a Black Doctor. I was getting lots of emails from people. I'm a dermatologist, but I was getting messages from all over the world, literally, of people asking me if they knew a Black doctor, a gynecologist, dermatologist, different specialties. And I did this back in the early 2000s. And then I thought, well, people get it. You can use the internet, and now there are search functions. And I stopped for a while, and then I relaunched it in 2019, because even in my own practice, even in New York City, people were having issues of access. In dermatology, we are the second least diverse specialty. And so a lot of times it is harder for people to find. And there's just a lot of data out there that shows that when people, African American people specifically, have access to African American health professionals, there are better health outcomes. They've even shown that in newborns that are taken care of in the NICU by a Black doctor, they don't know what race is. They have a better outcome for some reason. I don't know if it's that people can read cues or something. They are more likely to live. And then Black men specifically, if they have a Black male doctor, they are more likely to live. So I'm always down for supporting impactful initiatives to increase the health, improve the health outcomes in all communities and in the African American communities.
I absolutely agree. One of the reasons that we wanted to make She's Good for Real was that we had an insight that 55% of Black women were craving having a platform that was dedicated to us, because there wasn't anything that was really out there that felt like it was for us and by us. To that point, Dr. Strong, from a healthcare perspective, what are specific challenges Black parents face, and how can community support help address those issues?
I think Black parents face more issues of access to health care. Often they face financial issues, and then just not being clear that the information they're getting is tailored to their specific issues. Those are the things I think are a big deal. I mean, with maternal health, that Black women are 3 times more likely to die in the postpartum period. And so we have to do better with whatever interventions we need to make. We need to do research and investigate and find out why that is and what we can do about that to change it.
No, I totally agree with that. And some of the information just around access to care. So there's a large percentage that don't even have insurance. Even some of the most educated women who have insurance have experienced situations of bias and racism. If you've heard of Venus Williams, she almost died as a result of childbirth. There are lots of examples out there. And so to your point, Dr. Dina, just having access to doctors of color that can empathize more with the reality of what you are dealing with, it's not the same for every woman.
And I would say being able to advocate for yourself. African American women are more likely to report that they don't feel heard and understood and listened to in the healthcare setting. And so, with that awareness, you may have to communicate differently. You might have to be more assertive. You might have to have someone there to support you more in order to get that information through.
Yeah, could I just jump in on the education of healthcare professionals?
Of course.
Part of what we do at Huggies Healthcare is we have the best products. I mean, hands down, I couldn't work for a company that did not have great products. But more than that, it's what we care about. And what we care about is what's happening to the moms who we're serving. And so we know that a lot of this happens as a result of healthcare providers, right? You're at the mercy of who you're with, and you have to trust that they're going to look out for you. And so we live in a world, quite honestly, where we have to become comfortable with being uncomfortable. It's not easy to talk black and white. It's not easy to look inside yourself and go, you know what? I think I do have a bias here. And to check your bias at the door and leave your luggage outside as you go in to talk to a patient and really understand where they're coming from. There's a lot of trauma-informed care that goes into every person that comes in has their own experiences, and you have no idea what they've gone through. And so the education that we provide helps healthcare professionals to do that work, to go inside and look at, maybe I am not looking at this the right way. Maybe this patient should be treated in a different way. And so they learn how to address issues not only from African American I will also say that today's family does not look like yesterday's family. You have lots of populations, Black, white, LGBTQ+, transgender, incarcerated, substance abuse. I mean, that's the world that we live in. And so we trust our healthcare professionals that are coming in to help us through whatever we're going through. And that's how we can help to impact the high rates that we have of mortality right now, is to really educate.
When you were speaking about those personal stories, that actually was the impetus of creating She's Good for Real. It came out of real stories from real women at Group Black. And we decided that we were going to be on the forefront of helping to create a space that was educational with partners like y'all. So could you please speak to me, Valerie, about Huggies' role in supporting Black parents? Because I know that's been incredibly important, not just within your portfolio, but for the company, and the importance of actually working with partners like a She's Good.
Yeah, absolutely. So my belief is that industry plays a big part in this. And it's not just the healthcare provider, it's the village that we talked about. It's the community, the sense of community around everyone supporting each family that's going through their prenatal journey. And so Kimberly-Clark, it's a culture at Kimberly-Clark where we believe in better care for a better world. And so we live our value and our purpose by what we do, not just products, but also how do we look at the audience that we're serving. Our baby and child care is arguably the largest category for Kimberly-Clark. So you're going to have mom, and some of those products just from prenatal, you'll go through your menses, so you Kotex, and then you go through prenatal and you have a baby, that's Huggies. And then as you go on and you experience light bladder leakage, that's Poise. And when you go on to the glorious days of elderly population, you may need support with Depend undergarments. And so how as a company can you provide all these products and not care about what's going on with the clients that you're serving? And so I believe that it really is absolutely necessary and imperative that companies look at this. And for us, it has been a win-win situation in that when you look at the market, a couple of things are happening if you're out there in the manufacturing world. So we have a lot of pressure from imports and exports, mainly China. And to be honest with you, China makes good products. Some of them are good products. So those of us who don't manufacture in China and those of us who are looking at products here in the United States, it becomes tough and price margins are depressed. So when a customer has an opportunity to make a choice, they're looking at the company, and price equal. They're going to look at the company and say, what values does that company have? Are they aligned with my values? If I have to choose, I'm going to choose a company that's aligned to my values and supporting my causes. And so that's why Kimberly-Clark really takes pride in building programs around community that support those big challenges that are out there. We're comfortable being uncomfortable. It's a vulnerable space to be in, but we win. When you win, we win.
I absolutely agree. That's why we can't thank you enough for being a launch sponsor of She's Good. Because the maternal health information, it's there, but it's not readily available in one place that has inclusive content, that has a feeling like it was built for you. I mentioned this before, but She's Good came out of personal stories. And one of the things that we noticed was there was a lot of word of mouth. A lot of people were coming to you after you had done the research and you had had your experience. And I remember helping my friends navigate insurance. I remember helping my friends navigate how they were going to build their birth plans. And I decided that it would be way more impactful if we could have a site. I'm just one person. You're just one person in your family. You're just one person in your family. So media was going to be the piece that played that pivotal role. So could you speak to how media plays a pivotal role in amplifying the conversations around maternal and infant health disparities? while it is a hard conversation, both of y'all have definitely been in it.
Yeah, absolutely. We live in a media world. I think COVID pushed everyone straight to media. You know, how do you reach your customers? How do you reach anyone? We were all tied to our cell phones, right? And so when you think about that, building the ecosystem around what you are standing for. And so She's Good is one piece of an ecosystem. What I do is one piece. And so we look at that, and you use media, you know, to get your word out. We use media as well. Everything is electronic and digital. And so when you think about influencers, for example, the beautiful influencers that made It Takes a Village, absolutely did a wonderful job with that. If you haven't seen it, please find the links for it.
Yes, she'sgoodforall.com.
Yeah, and so our influencers are our nurses. Our nurses are the most trusted profession in the world. And so they influence when mom's going through their prenatal journey. And so we have nurse influencers as well. There's one influencer, his name is Nurse Blake. And I don't know if this is a big number, but it's a big number for us. He is a nurse who started a campaign around nursing and some of the struggles that nurses have every single day around supporting their protocols and practices. And he has 1.43 million followers. Is that a big number?
Yes.
Yeah. I don't know.
We can get into
So
macro
considering
there.
that there are about 200,000 maternal nurses, to have 1.4 million followers is huge. And so those influencers influence everything from purchase decisions to what am I going to be mad about today? Or, you know, they really do drive a lot there. So we believe in social media. Social media is absolutely the way to get the word out. And social media often, a content plan every single day, driving content, pushing content out there. You guys are the experts at that.
And Dr. Strong, you built findablackdoctor.com, so you understand the power of media. Do you want to talk a little bit about that?
Well, yes, we live in an attention economy now, they call it, because of our devices. You know, people are spending a lot of their lives looking at things. So I think it's important to put quality things in front of them, understand what it is they're looking for, what it is they need, and using media as a tool rather than as a distraction to get them high quality content, helpful information, and increase their access to the services or products or information that they need. So I think it's very powerful.
Apologies, y'all. I agree. So let's go into what kind of strategies can organizations employ to build and sustain supportive connections that empower Black parents throughout their journey? Because that's something that both of your companies have been able to do so well. She's Good just launched, and we are hoping to do the same, following in your footsteps. But I would just love to hear about some of the strategies that you're utilizing.
Yeah, strategy, you have to have a plan. And ideally, it should come from the top down, right? You want your CEO, and then it comes through your funnel. That doesn't always happen. It did not happen for me in pushing this campaign within my company. I've been working on this since 2019. And finally, they started to hear, see, listen. They saw results with market share going from 30% to 50% in our high birth rate markets. And so the company now, it started in the middle of the funnel and it's gone up. And now there's a true belief from the top down, and this is the culture that we want our company to have. And so what we strive to do is build relationships with other organizations. I think I mentioned before around our ecosystem. So how do you build an ecosystem? We partner with March of Dimes, right? They have their platform. We partner with the Association of Women's Health, Obstetrics, and Neonatal Nurses. That's an organization for every step through pregnancy. You're going to meet one of these nurses, and we work really hard with those organizations. We partner with folks. Instead of going in, I'll just step back for a second. When you look at your budgets and what you're spending every year, and you have to justify what you want to spend it on and why. And so if you look at the budget and you say, well, we're going to buy this, this, and that. I'm going to have this media spend. Well, it's fine to have a media spend. However, you really want to take the time to say, what is this organization about that I'm purchasing this spend? What is it? Do we have synergies together that we can actually work together and form an ecosystem around this topic? And so that's what we've been able to successfully do with She's Good, right? So once we met this wonderful company and we knew what they were about, we said, this is a perfect partner for us. This is a good way, a perfect way for us to get the word out there. And so our ecosystem continues to build, and as it builds, you build credibility, you build your brand, you build your customers that way. And so we've been very successful in reaching healthcare professionals, in reaching moms, in reaching organizations, and we even are on the Hill. So we go up to Capitol Hill and we work legislatively to help pass bills that support this. Recently, Joe Biden passed the Momnibus Act. Yay. Finally. Right.
Finally.
5 years later, it's been passed. So those are the small steps that you take to build this entire ecosystem to really make a difference in the world. So we're impacting lives.
So what I heard from that is it feels good to help out, but if you want to impact your bottom line and you know that your future consumers care about this, they are having truly personal journeys when it comes to maternal and infant health, take action. Lean into partners who have those synergies so that you can actually have your bottom line be hopefully lucrative.
Yeah.
So let's go into how do you measure the success of some of these community support initiatives, because it's one thing to put it out in the world. It's another thing to understand whether or not you felt it was successful.
Yeah.
So, I would say, I'm coming from a smaller business. I have my private practice and then I have my platform, findablackdoctor.com. So right now it's me listening. And when I start to see things that I've been talking about that people didn't seem to be aware of start to become mainstream in the media queries about that, patients coming in and actually knowing about it before I tell them. Those are the little signals I'm getting at my type of business that it's having an impact. For people already knowing about Find a Black Doctor,
I personally did.
When I'm thinking it's like my little project that I'm working on, it's actually already having an impact on people all over the country.
It's changing lives.
Yeah, it's giving them access.
I will just add that it's tough to measure feelings. So that's qualitative and it's not quantitative. But each of you who have experienced healthcare, oftentimes you get a survey that comes back and will ask you, how was your visit? What did you feel? Did anything happen to you? So that's where measurement starts. And then also every birth is recorded, every health encounter is recorded. And so mortality rates come from the number of people who have died as a result of childbirth. And so all you can do is to feed the system in some of the things that I talked about and helping to change some of the attitudes there. And then as measurements continue to come out, you can see hopefully a decline, right, in mortality as it goes. And we just had that measure come out, and sadly it's not declining. So there's a lot of work to do, and I think avenues like this for each of you out there to pay attention to that, become advocates for that. It's hugely important for every single person in this audience and in the country that we pay attention to healthcare now more than ever, and just realize that our corporate responsibility, we take pride in our corporate responsibility in trying to impact 30 billion lives by 2030, I think it is. So again, from the top down, from the corporate structure, just being able to strategically know that while your job is to bring revenue, especially if you're on the stock exchange, you still have some responsibility to the customers that you're serving. And trust me, serving those customers, they're going to buy from you because they trust you. So, yeah, thank you.
I knew that when we built this, I told myself if I could change one patient outcome, or if there was someone who could say, this information helped me, or this birth plan template helped me, that I knew that I had done my job. Because it takes one, and then another one, and then someone is speaking to someone about their experience and what they were able to do to navigate and advocate for themselves.
That's your village.
And that's your village.
You have to build your village.
It's true.
Yes.
And so, at least for me, I am on the same path as you. I'm wanting to see the mortality rate go down. If a year from now we're seeing that, then I know that She's Good has had a place and made an impact.
Yeah.
Last question. I can't believe this is our last question. Can you discuss the importance of culturally tailored healthcare and community programs in reducing health disparities? So really tapping into spaces that are safe for us.
Well, I'd start with, in my own specialty, dermatology. It would seem like that would be obvious because, one of the racially defining characteristics, or many of them, are skin and hair, and they just require different care. And when I went into dermatology, I wasn't even aware that we were the second least diverse specialty, and I had always picked places to train. I was in the East Coast and Connecticut, and then I was in San Francisco, LA. So I made sure that I got exposed to a diversity of patient populations and the types of programs I trained. But I actually was ignorant because I wasn't aware that that was not the case for everyone. And so, one of the things we're working on in our specialty through a lot of the diversity and equity initiatives is making sure that we have pictures of conditions like psoriasis, which are often just shown on white skin. It's a different, you have to understand how to a diagnosis on people with different skin colors. I'm a big hair loss person, so I was kind of surprised when I started my practice in New York and people were coming to me with what I thought were pretty straightforward hair loss problems, and they'd seen multiple dermatologists and that they hadn't had the training in hair loss, and specifically, say, on African American women, that they'd give them advice such as use this medicated shampoo every day to treat your seborrheic dermatitis, which is dandruff. And that practice is actually very bad, damaging for curly, kinky hair. So I didn't realize that we needed this because I had it. So it's sort of promoting that within the specialty outside of the bubble of what I know, and fighting for that, because there has been some resistance in my specialty about making sure that everyone is educated about the diversity of the patient population. And then also the pipeline. Because there are things that you bring, not just from your training, there are things I know about taking care of people that wasn't taught to me in school or in my residency, just so that I know about how people live. And so that's why, diversity, equity, inclusion is very important in the healthcare pipeline.
Absolutely, I totally agree. And I mentioned this before around the diverse populations. Kimberly-Clark is a worldwide company, 44,000 employees globally. And I think in the United States, there are about 10,000. And so you can imagine how diverse the population is. And I mentioned before, Black, white, Hispanic, LGBTQ+, incarcerated, parents going through surrogacy. The family today doesn't look like the family yesterday. There are what we call employee resource groups for employees that allow us, as a member of African American Network, that allows us to get together and build programs within our communities. Every resource group has one. And so it really still comes back to the culture of accountability and the culture that's created within the organization that you work for.
Well, everyone in this room can be a part of a village.
Yes.
everyone in this room can go to shesgoodforreal.com to see how Kimberly Clark has been able to help create villages. But I urge you to continue having the conversations. Make sure that you are helping to advocate for others. Make sure that you are asking questions and leaning in. That is what it takes to build a village. And we'll continue to do so on our end. So thank you both for joining me today.
I want to thank you, Ashley. Thank you so much for
Thank
your
you.
partnership. We appreciate you. We do. Thank you for your passion.
Thank you so much, Valerie. Thank you. Bye, everyone. Ooh, I did it again.